Welcome, everyone, to this webinar on when should my church or ministry reopen? That is the question of the hour, certainly the question of this week. And I know that that's on the hearts and minds of many church leaders and ministry leaders as we're moving through this pandemic and hopefully moving into the next phase. So our goal today is to provide you with some practical information to help you make a good decision. I was thinking last night, I had opportunity to be on a walk with my son, who's about 17 months. And his new thing is he loves walking the dog. And so he's got the leash, and we have a younger dog. His name's Toby, a long-haired Chihuahua, who just loves to run. And so as I'm watching my son, in a sense, walking Toby, I just kind of had the question of, well, is Gabriel walking Toby, or is Toby kind of walking Gabriel in this sense? And I don't know if you kind of have that same sense as a church leader. I want to be a good steward. I want to be a good leader during this time. I want to lead my ministry well during this pandemic, but I sometimes wonder, am I actually the one leading, or am I just kind of being dragged along by all of these changes? And so I wanted to make sure that I'm being intentional and strategic about leading well during this time. And that's what we want to help you do with some good information in this webinar. So as I begin, I wanted to share just a little bit of information about the Daniel Initiative, which is putting on this webinar. Of course, here's our topic, webinar medical, legal, and practical consideration for next phase planning. The Daniel Initiative is a ministry of Indiana Family Institute, and we're focused on building relationships in between the ministers of God and the ministers of government, with the goal of ministering to them personally in their own spiritual walk, also in their role as a government official, and then partnering with government officials to seek the common good. And then certainly we want to give church leaders good information, sound information at the intersection of faith and public life as we navigate these changes. So that's the Daniel Initiative. There'll also be pastors joining us today from around the country that are familiar with the Good Citizen Project, and that's my more national writing and speaking ministry, and also the ministry through which I provide legal partnerships. So welcome to all those joining from around the country as well. Now, as we jump in, I wanted to give you a bit of an outline of what we're going to be talking about. Again, when should my church or ministry reopen? I have three thoughts for you today. Number one, consider biblical principles. Number two, consider medical and legal guidance. Number three, consider the needs of your ministry and not just how everyone else is responding. So I'm glad to be joined today by Dr. Cole Beeler, who is an infectious disease expert, works at IU Health. And so I'm looking forward to his perspective on this. I am not a doctor, and so I've asked one to come on and talk to us about what to expect next. Also, we have Brian Bowman, affiliated with Alliance Defending Freedom, an attorney in Lexington, Kentucky, someone I deeply respect both for his legal expertise, but also for his walk with Christ. And so I'm looking forward to hearing him as well, trying to navigate the issue of religious liberty and when do we say this is overreach and when should we comply. And so I'm looking forward to his perspective as well. So I received a specific question from a church leader about the biblical principles. And so I jump into this realizing that I'm speaking to church leaders that certainly know biblical principles. And so I was just trying to think of what could I provide that would be helpful. And so here I wanted to share with you five key biblical principles. And I don't often put a lot of info on a slide, but I wanted to share these with you so you can read them and think about them. As I've looked at this question, I found these five principles helpful to keep in mind. Now, note that as a ministry, we're big on two things. One is conscience. We refer to the conscience of individual church leaders, but we're also big on biblical wisdom. We need wisdom to apply biblical truths to the momentous changes in our lives and ministries. So here are these principles. If government's operating in its biblical role of restraining evil and promoting good, then Christians should follow government's guidance, and that's 1 Peter 2. Though many churches have temporarily canceled gatherings, the in-person assembly of believers for worship, discipleship, and fellowship is an essential biblical requirement that cannot be canceled long-term, Hebrews 10:25. If a scenario is complex or unclear, Christians should apply wisdom with a focus on the church's public witness, Mark 10:16, Matthew 5:16, Matthew 28:16 through 20. If government restrictions interfere with biblical beliefs or practices, Christians should seek clarification and accommodation prior to practicing civil disobedience. You see that in the story of Daniel, the story of Esther, and also Romans 12:18. Finally, if government is acting in direct contradiction to biblical principles or in violation of its God-given authority, then Christians should follow God's commands. That's Acts 5:29. And so I wanted to provide those biblical principles to you as you're thinking through this. And for our ministry, we have encouraged churches to temporarily cancel in-person services in an effort to help slow the spread of the virus, and also to show the love of Christ and to show support for our communities. Now, we also have strongly encouraged governments to allow drive-in services, and would note that even the current restrictions allow meetings of less than 10. And so as we move into this next phase, that's our position, but we certainly would defer to the conscience of church leaders that have applied these principles but landed in a different place. And so I wanted to share those biblical principles. That's the first step. Always, we want to be in line with Scripture. Next, we're going to jump into, we need to consider medical and legal guidance. We should consider medical and legal guidance. So up next, we have Dr. Cole Beeler. I'm so thankful for him taking the time out to join us. And when we recorded the webinar, we had a technical issue that cut off the first couple of minutes. It wasn't such an issue because it cut me off. All right, nobody's crying too much about that. But it did cut off just the first slide or two of Dr. Beeler's presentation. And so the first slide was this: when should my church or ministry reopen? Dr. Beeler mentioned his experience, which he's been thinking through and working on this question of how do we slow the spread of COVID-19, and he's specifically been doing that in the medical context, talking to nurses and doctors about protecting themselves. And then also he moved into the fact that this is a global pandemic. And then as we bring in the rest of the presentation here in a second, he'll begin talking about what are the infection rates in the state of Indiana. So thankful to have Dr. Cole Beeler on. A little bit of his presentation got cut off, but then we're going to segue just now to the rest of his presentation.
We're probably only seeing the tip of the iceberg when you look at Indiana numbers as to how many people have actually seen this virus, how many people have been infected with this virus over time. We've been doing a lot of projections. I'm sure you guys have seen a lot of projections as to how this pandemic could occur. Usually how pandemic occurs is with exponential growth, as you would expect with this type of R0. You see a potential of millions of people dying from the virus. And this is one of the graphs that was used by the White House to show the consequences of failure to do social distancing. So social distancing is the main mechanism by which we are attempting to, quote unquote, flatten the curve. And that's been hot out in public and in lay media as it relates to trying to decrease the amount of people who are getting infected over time. So it's a slowing down of the rate. Now, you'll notice with the flattening of the curve, and the goal of flattening the curve is only to slow down the rate of infections. It is a stall tactic. It has no basis and does not necessarily mean that the absolute number of people infected would be different. So flattening the curve and social distancing, by social distancing, does not necessarily mean that we are decreasing the absolute amount of people that are getting infected. Social distancing is around the fact that these droplets tend to hit the ground by about 6 feet. It's actually probably by about 3 feet, but 6 feet is what's definitely safe for these droplets. So if you can keep a 6-foot radius between you and the other people you're not used to being around, that could protect you from being infected. The CDC has recommended augmenting that with universal masking for people who are in public. These are cloth masks. These have bad data behind them. They are not absolute. And I would mention that the utility of masks is to protect the is to protect the person who is not yet infected from getting infected from someone. And the way that that works is that if you're infected, you have a less of a chance of passing on the virus if you are wearing the mask. But if you're not infected, that mask doesn't necessarily help you. The recommendation for wearing the mask is that we don't know who's infected and who's not infected, right? Because there's this huge asymptomatic fraction that we're trying to understand. So social distancing has been one of the things that we've seen and actually has yielded dividends. You can see here in our graphs, this is from the world. The world has 3 million cases, 211,000 deaths as of this morning when I made these. And we've kind of flattened out across the world. So in the US, 908,000 cases with 56,000 deaths. We're projected to have 74,000 deaths in the US by current model estimates. In Indiana, we have almost 16,000 with 844 deaths, projected to have 971 cases. But what you'll notice here in Indiana is that we're starting to see a bit of an increase. that might be due to a number of different things. One is that downtown we're actually decreasing. So in Marion County, things are flat, if not decreasing, but we're seeing more cases in the periphery, like dropping a stone into water. We're seeing ripples kind of move outwards from the center of Indiana. In addition to that, this is interesting. This is something one of our analysts put together, but Google has this social distancing metric. It actually has this mobility data where if you have location services turned on your phone, it's actually watching how much people are moving around. And you can see towards the beginning of the epidemic in the United States in Marion County, our social distancing, which is the blue line, really improved. We went way down for our mobility. And you can see a proportionate decrease in our COVID cases over time. But what I draw your attention to is that we're starting to see, especially as it gets warmer outside, social distancing get worse. And because of that, we are seeing an uptick as well in COVID numbers. And the reason I bring this up is because that's not unexpected. As we release social distancing measures, as we start to clump together more, we will see more cases. It is inevitable that that will happen. And talking about this second peak, in my opinion, is something that we will see. It's just a matter of how fast we see it and if there's going to be second, third, fourth, fifth peaks after that as we gradually decrease the social distancing measures that we have. So with social distancing, really what we're doing is maybe delaying a peak, decreasing the extent of peak is all possible. And in addition to that, I can't tell you for sure with COVID if it's not going to set up seasonality. There's a lot of people smarter than me that are that this is going to be something that we might see every September, October, November, like we do the flu. The take-home point really is that there's a large fraction of the population that will get infected before herd immunity develops, if herd immunity is even something that we can attain. But herd immunity for this is anywhere between 50 to 90% of the population being infected. At probably around this point in time, we have in Marion County probably about at maximum 40% of the population infected, in Indiana 19% of the population who's been infected. And that's assuming that we use numbers from California where there's a large percentage of asymptomatic patients that are also infected that haven't sought medical care. So the big question becomes, if we're waiting for herd immunity, or if we're trying to get to herd immunity, who are those patients that should be infected? And that's a really weird thing to say, I know, but if we could triage patients to the people who we would not want to be infected, who would those patients be? Well, these would be patients who would be at high risk for bad stuff happening if they got infected with COVID. And those are patients that are greater than 65, patients living in nursing homes, and patients with chronic medical conditions that I list here. In general, we want those patients, and the whole theory behind herd immunity is we want the patients who have been exposed and who have become immune to protect the patients who have not been exposed and not been immune. And we want those patients to be the people who are at high risk for bad stuff happening. So really, with relaxing of social distancing measures and how to make this decision, should be a tiered and slow approach. We want to be drinking from a faucet that's been slowly on and not drinking from the fire hose. And a lot of it has to do with resources, right? So if we relax everything and we go back to normal tomorrow, the hospital could easily be overwhelmed. We have a large fraction of our Indiana population that has yet to be infected, even in the most liberal assessment of how many people currently have the infection or have been infected. If all those patients hit the hospital at once, we could run out of personal protective equipment. We could run out of masks, gloves, gowns. We could run out of beds. We could run out of ICU rooms. We don't want that to happen because with those things, we see increasing mortality. We see increasing healthcare worker exposure. So we want to make sure that we protect our system that's in charge of taking care of these patients as well as the patients themselves. So the White House has released something that I actually really like, which is a tiered approach to relaxing certain measures. And they have gates, and the gates are essentially established by three things. One is symptoms decreasing, two is cases decreasing, and three is hospitals maintaining adequate availability to take care of sick patients and that testing is available. And if you're able to see decreasing numbers with retained ability to take care of patients over a 14-day period, then people can start returning to work. This should be phased in. Large venues, of which churches are included, can operate under strict physical distancing protocols. I will mention that, in my opinion, we're not quite at gate 1 yet. We do not have antibody testing. We have not seen a decreasing trend over a 14-day period yet, but we're getting close, especially in Marion County. Gate 2 is you've done gate 1, but you've done it for 28 days now. And that's when non-essential travel can resume, and large venues like churches can operate under moderate physical distancing protocols. Gate 3 is after you've met it for 42 days, and that's where vulnerable individuals do normal activities, and large venues can operate under very limited physical distance protocols. So how do we get past the gates as a community? One is we need to get the rate to a manageable level with social distancing. So that means doing as much as we can to continue to limit our exposure to other people. At this point, I still think that that's prudent. And the reason why is because eventually what we're going to want to do is start loosening the faucet, right? We're going to want that drip rate to increase. We're going to want people to start exposing themselves to people. As people expose themselves to other people, there will be more infections. And if that's a pretty slow rate, then actually our public health departments can watch this a little bit easier. So public health departments, as people get infected, will be not only watching closely what our numbers are, but responding with aggressive testing. And in response to new clusters of diseases that they'll be seeing, they can tighten local faucets. They can say, okay, there's been this big outbreak at, for instance, this gym, so we got to shut down this gym. But also, what they can do is they can do contact tracing. So contact tracing is if you're a person who's infected, you get interviewed and you talk to everyone who has been an exposure to you, or you tell the public health department who you've been exposed to, and they track those people down and quarantine them. And this is how we isolate infections. This is how we essentially starve the fire, is making sure that we know everyone who's had a legitimate exposure. This is very challenging to pull off if that drip rate is extremely fast and we're drinking from the fire hose. If we have a massive exposure, say in a church or a large group gathering, contact tracing in that setting is not feasible. And you're just going to see a huge increase in cases, which potentially could overwhelm the healthcare setting. So tiered response, and only after a smaller rate of cases is really what is being recommended at this point. In my opinion, in medicine, especially as we approach older populations, there's this adage that's start low and go slow, and that's what I would do here. I would go slow, but I would go. I think that we're going to get to the point where, again, like I said, this is all eventual anyway. In my opinion, people will get infected, and the way we progress, if it's slow, will be the safest way possible. So I would continue to advise vulnerable populations to continue to isolate until we're sure that we're on the right track. Attempt to maintain a 6-foot radius and cloth masks for parishioners and people who are attending services. In general, that's about 2 seats to the right and to the left, and an empty row above and behind gives you about that 6-foot radius for droplets not to land on people. Understanding local numbers, I think, is very important. So having a feedback loop in your church or your gathering area where you can figure out if people are getting sick so that you can respond locally, and then developing local levels where you can pull and push. So for instance, small group settings are a lot less risky at this point than large group settings. So maybe start small and then continue to grow into larger groups. So there were some questions that I was primed to. I know I'm running short on time here, but I'll run through these pretty quick. So how fast do I think that herd immunity will develop? So first of all, we don't know what the asymptomatic fraction is. It's very difficult to predict. I'm not even entirely sure if herd immunity is possible at all. We don't have really good precedent from other coronaviruses that that's possible. Assuming a steady increase, my guess would be based around July to October, when I would expect to see herd immunity start kicking in, if it is possible. It may get faster. It may go a lot faster if we expose a lot of people a lot faster, but it will also result in potential for increased mortality and morbidity. Will a vaccine be effective? I have no clue. There's no precedent for a vaccine working for coronavirus. It's going to take 12 to 18 months to develop, so that will be after potential herd immunity at the current rate. I'm not optimistic about this, but it is possible. There was a good vaccine candidate for SARS-1, which means it's at least theoretically possible in early stages, but it's going to be delayed. Timeline for reopening. It really depends on a lot of factors that hinge on adequate preparedness of the hospitals as well as the public health departments. So since there's so many factors involved, I've been really using the state to take all of those things into consideration to determine when I would feel safe opening up other businesses. But I understand this is a moving target, and I do understand the importance of opening up churches. And in my perspective, a tiered response is appropriate really at any time. And then the last one I think has been something that's probably most important is any spiritual or personal lesson that I've learned. So it's drawn to Psalm 94:19, when anxiety was great within me, your consolation brought me joy. And the main thing that's really typified this epidemic and pandemic for the healthcare community is fear. And I know it's been that way from even outside the pandemic, but most of what I do on a given day is trying to curb fear responses from providers. And I myself have had a lot of anxiety about this, because to confidently tell someone that they're going to be okay just wearing certain PPE or just doing certain procedures takes a lot of courage. And that can be isolating. And I think a lot of providers feel isolated right now. And a big thing I learned was that you're not going to find consolation unless you're looking for it. So even though it's there, I had kind of shut myself off at the beginning of the epidemic and pandemic just because I was so busy and so stressed. But it was only after things maybe started settling down that I realized that Jesus and God have really been there for me the whole time and have been supporting, the decisions I've been making and making sure that they're grounded in what the right thing is for the community of believers. So that it's really tough. And I don't envy your positions. I think that it is very, very challenging. And I acknowledge that this is what I would consider to be an essential service as well.
Cole, thank you so much. That was really helpful. And a couple mentioned, can we get a copy of the slideshow? I'm sure we can get a copy of that afterward and send that out. So thank you so much even for your encouragement. I think just the perspective of serving God in your role as a doctor comes with challenges just like leading a church. All right. So next up we have Brian Bowman, an attorney. And I was joking with Cole and with Brian earlier that it is great that we have Zoom and that we can submit typed materials, because if we actually had to write any of this out, no one would be able to read it, at least not my handwriting. One last thing that I'll mention about Brian is that, and you just need to know this so you can consider it as you consider his advice, and that is he is a huge UK fan, huge UK fan. Now I know there's one other UK fan on here, but other than that, he's a great lawyer, so just try to pass that piece of it. And so Brian's going to talk to us about First Amendment issues.
Thank you, Josh. Normally when I get to speak in Indiana, it's coming right off March, and we're really, really busy in March and early April in Kentucky watching basketball. That didn't happen this year. I didn't go to IU. I didn't go to IU med school like Dr. Beeler, but I'll say this for all of our doctor friends. When your professional ancestors were working with leeches, mine wrote the Constitution and the Declaration of Independence. So, and good news for all the pastors who are here today. There were 56 signers of the Declaration of Independence, and 20 of those had a divinity degree or returning ministry. So, Doc, we're even short here today with our crowd. So I guess just the basic legal lesson I want to give you all for today is, as you're looking at the different protocols, recommendations, and requirements that are coming out from our different state and local governmental entities, the thing to keep in mind is, how does that affect you and what may your legal rights be? And there's two basic principles: neutrality and general application. In other words, is the law neutral? Is it neutral toward religion? Is it neutral toward your church? And secondly, is it generally applicable? These cases have been long developed by the United States Supreme Court and followed in every state. So I want to kind of talk you through those and give you some examples. Now, most people are familiar with the First Amendment. Congress shall make no law establishing religion or prohibiting the free exercise thereof. So there's two parts. And a lot of the cases that people remember are the first half of that, the Establishment Clause part. The classic, 10 Commandments on the courthouse lawn and what can be done in schools. This is the second half of that. This is the free exercise part of it. But to a large degree, the standards are really the same. If you think in terms of neutrality, and one of the more recent cases from the Supreme Court that my colleagues at Alliance Defending Freedom had was a case out of Missouri where the state of Missouri had a tire recycling program. And tires came in, they were chopped up, just ground up into very fine little bits and then made available under a grant program for playgrounds. And so a church ran a daycare and applied, and were various factors that the state of Missouri utilized to determine who would get the limited resources. And that daycare ranked very, very high, but the state of Missouri excluded them because they were affiliated with the church. Well, if your church ever catches on fire, you can call the local fire department, right? No one would ever make an argument that a church building on fire, reaching out to the local fire department, somehow violates the Constitution. And so that's the same basic principle as a state has to be neutral. It can't favor or disfavor religious uses, purposes, or buildings because of what goes on inside them. So it's that neutrality principle that's really important to focus on. Well, how's that work in this context? Well, a very famous United States Supreme Court case from the early 90s came out of Hialeah, Florida. And the Church of Lukemi Babalu I there practiced Santeria religion. And part of that was the ritualistic sacrifice of animals. So the city of Hialeah passed a local ordinance that banned the slaughtering of animals in a ritual ceremony. The problem with that law is there's a very large slaughterhouse in Hialeah, which was allowed to continue. And so the challenge gets to the Supreme Court, and what the Supreme Court says is this local law specifically targeted religion. And any law that targets religious purposes, religious users, it's almost always going to be unconstitutional. Well, in this context and in this world we're living in, there was one recent case, recent situation that came out of Mississippi, out of Greenville, Mississippi. The city of Greenville, now let me back up. The state of Mississippi had, in its orders, had specifically listed church worship services as essential businesses. But the city of Greenville went one step further and had an executive order through its city that was actually titled an executive order regarding church services. Now, if something is not unneutral, if it doesn't target a church, when you name it an order regarding church services, you've kind of already lost the first step in your legal battle as the city. But what this specifically did was it prohibited any type of drive-up service. And so a local church there called Temple Baptist Church was having a drive-up service. It was actually the minister was inside. It was broadcast over the FM radio. Vehicles were sitting in the parking lot. They were spaced adequately apart. And 7 or 8 police officers arrive and go door to door to each car, have everyone roll down the window, they take licenses, and they issue citations. Now, the huge irony in that is they were attempting to limit in-person contact, and yet that's what they did by having officers visit each and every single car. So there's some significant irony in that. So a lawsuit was filed. The court quickly addressed it and realized that, look, you allowed other drive-in services. You specifically targeted churches. The very term of the law you enacted specifically addressed church services. And so that is not a neutral law. That's specifically targeted church services in that aspect. So the second half of what we want to talk about is a law generally applicable? Well, and some may think, well, look, in health and in public safety, how can something be generally applicable? There's an easy answer to that question. Building codes, right? Many of our building codes, and churches are exempt from some, but in many of our building codes, require sprinkler systems. We require firewalls in our stairwells. We require certain types of doors. We require certain types of lighting. That is the type of enforcement arm that the state has, which applies to all buildings above a certain size or of a certain type. Think of it in the context of the lawsuits that accumulated at the end with the Hobby Lobby Conestoga Woods cases that ADF also had. And you will require that the HHH mandate at that time under the Obama administration required employers to provide certain abortifacient drugs within their healthcare plan. But it had a number of exemptions. One exemption was if you were grandfathered in. In other words, if your healthcare plan never changed, You never had to offer those abortifacients. Secondly, it only applied to certain number of employers with a number of employees. So if you had a small business, you were exempt from it. If you never changed your plan, you were exempt from it. Well, what happened? Well, the very nature of that law had so many exemptions, it completely swallowed the rule. So it's not generally applicable. It didn't apply to everyone. It exempted certain people based on their size. It exempted certain people based on a lack of change. So that law was not generally applicable across the board. Well, how did that work in this context? One lawsuit that's still in the midst of going, it's like a week and a half old, is out of Kansas. And some of you may have seen some of the news reports there that the lawsuit was directed to the Kansas governor. So her order originally exempted 27 different types of facilities, libraries, those types of things, which included churches where people of more than 10 could gather. And then at a later date, she pulled back those exemptions where churches were no longer included, and it addressed groups of 10 or more, but the 10 didn't count for like the minister or the music leader or the praise band or the choir or the pianist. And so those didn't count to the 10. And when the governor started to unwind some of those exemptions, the church got left out. And so that was the basis of that lawsuit. On a similar note, an interesting case, and this may be an option that many of the pastors ultimately want to consider in the very near future, was in Raleigh, North Carolina. And the church there in Raleigh, North Carolina had prepackaged communion packets that were available in the parking lot for people to address. They also had a system in place, and I know many of our pastors are concerned about this because so many people have reached out for it, on a way to collect the tithes and offerings that folks had done. And so it was going by a system not unlike what you get in the McDonald's drive-thru. And so originally, the county governing body there was going to enforce those rules against churches. And the church wrote a letter to the county, and that day, the county said, you know what, you're absolutely right. There's no distinction between picking up a prepackaged communion packet in the church parking lot versus to going through the McDonald's drive-thru. In fact, that's prepared by hand. There's probably a greater risk than it would be to that. And so that is not something that was generally applicable. It applied to some, but creates such an exemption that it basically, the exemption swallows the whole. And so if you ask, as you go to look back to return, I would just suggest that you have to look at what's being asked of you. Is this something that specifically targets it? Is it local? Is it at the statewide level? But does it specifically target a church? Or does it create so many exemptions that the exemptions just don't make sense why they would apply in other contexts, but they won't apply in your context? Now, having said all that, let me conclude by this. There's a difference in what's going to be legal and what decision you need to make as a pastor to lead your congregation. I know many of the governors throughout the state have said that it's going to be a statewide rule. That may be the right course. I don't know. And they bear a very, very heavy burden for what they have to do. But you have to make the decision for yours. I know within our own law firm, some of the decisions that we have to make on returning to work are, should everyone come back at once? Should we come back in phases? That's very difficult to do in a church because everybody's going to want to be there their very first Sunday. So you have to decide, do we wait? Do we wait an extra month, an extra 2 months, so that when we come back, we can all come back together? Or as many of our health experts have probably very, very rightly recommended to us, there are certain segments of our population that are more vulnerable. Do we, as ministers, do you wish to make those decisions about who can return to church and who can't? Those are very, very tough decisions to make, and they're really not legal ones. So I don't have much to offer you on that. But I know that through prayer, through conversation with your colleagues, through conversations with your church leaders, you can make that as a group decision and to communicate that out. But if any questions arise, whether it's just, hey, what should we be doing locally, or this local government or this state agency seems to be targeting us. They're not acting neutrally. They've created a host of exemptions that seem to be too broad, but yet we don't get the same treatment. That's when you reach out. Reach out to Josh. He can help. He certainly knows how to get in touch with me and all of our colleagues at ADF, and we'll be always glad to discuss that with you. And thank you for having me, Josh.
Thanks, Brian, so much for being on. And one thing that I often stress to church leaders is just the wealth of resources that the church has when it comes to First Amendment attorneys. And I sometimes joke about the fact that First Amendment attorneys are kind of like ambulance chasers, but with halos, and that we're looking for these cases. We want to see the First Amendment upheld. And that's not to denigrate Brian at all. He's a very dignified individual, as you can tell. So we've talked about the medical side of things. We've talked about legal guidance, and just wanted to reemphasize that if you're being treated differently than similar public assemblies or similar businesses, that's the time when we can bring a case and challenge that. So I wanted to just wrap up with a few very practical considerations as you're thinking about, now I've got to make this decision for my church. What are some just practical guidelines as I'm preparing to reopen? And I've spoken to several church leaders, whether smaller churches or multi-campus churches, about some practical ideas. I'm going to show a PDF to you. Don't worry about trying to write down all of this information. We're going to send this out by email, but I did want to just pull it up so that you can see what we're working on here. And so this document will go through kind of the 3 steps that we've talked about. But as you come down here to what are the best practices for reopening, I think that the time to start planning for that is now. And I know many church leaders are already beginning that process, but particularly just because of the need for personal protective equipment or even for cloth masks, for sanitization equipment, that's in high demand. And so you may need to order that now, even if you're going to be opening up in the next couple of weeks. One big pointer that I'd mentioned just as you're getting together with your church leadership to plan, and that is you need to check with your insurance carrier if you haven't done so already, and especially if you want to bring a First Amendment claim, if you're defying a government order, that could have profound effects on your insurance carriage. So that would be one thing to consider. In the state of Indiana, and I was listening closely yesterday for Governor Holcomb's announcement, because his initial stay-at-home order, or actually a second stay-at-home order, is supposed to expire on May 1st, which would be at the end of this week. And I'm waiting for any indication of what's going to happen with churches. He was specifically asked by a reporter yesterday, what about large assemblies like churches? And he didn't specifically answer the question. But I imagine there's going to be guidance, and he hinted at this yesterday. There's going to be guidance from the state by the end of this week. He has to announce, okay, it's going to end on May 1st, or I think he's going to produce additional guidance. Something that Dr. Beeler mentioned is that our numbers have spiked to some degree, particularly because of an outbreak, I believe, in Cass County from a chicken processing plant, as the government's trying to look at, hey, are the numbers popping? So we can back up. Some churches are going to kind of staggered opening, as Dr. Beeler mentioned, maybe starting with off-campus small groups, then to on-campus Bible studies and small groups and services. Beeler mentioned kind of the 3 phases of the reopening plan. And a lot of the first material I've seen talks about how nursery, children's ministry, youth ministry are discouraged. And also, at-risk individuals are encouraged to remain just participating in online services, but then consider services by name or utilizing an online reservation system through that social distancing requirements are followed. I mentioned a church in Fisher that actually held services of less than 10. Now, that's a controversial issue, but that is one decision that churches have made to say, well, we might have mandates, but Scripture says that we need meat. And so that's the church navigated these. You're going to plan with your church leadership. I will also include in the email to everyone a draft from the CDC of guidance for faith communities. In this draft, so understand that everything I'm sharing with you is subject to change, but it's some additional guidance as you're trying to just following some of the recommendations. We mentioned the question about communion. Brian, Dr. Beeler mentioned this in passing, prepackaged communion materials. One big issue that has a legal implication is, as people go to your facility, you ask them if they are experiencing if they tested positive or been diagnosed with COVID-19, contact. And if a person says yes to those questions, you want to encourage them to worship home. As you read through these, understand that I give general information, but I would certainly defer to your conscience and your faith community and how you implement these. Maybe a question about one-way traffic going through the church. I think that's helpful, and I'll pass that to Dr. in a second. But I think that is something that could be helpful. Billy, do you want to go ahead?
Yeah, I think it's probably overkill, to be honest. It makes sense, but where we see transmission is really with prolonged contact over about 10-15 minutes, and it's not these just by that not being physical. To me, a bigger risk would be sitting next to someone who's in service crossing the hall. But there's a lot of places that are doing this. I think it's creative. I wouldn't be averse to it, but it seems like a little bit overkill.
That's helpful. The big takeaway here would be the cloth masks for everyone, and even a kind of sanitation team that's working through the facility even during that. It's not seen in a lot of resources. What if somebody at your facility becomes ill during this? And so the basic guidance is identifying a separate room or space where you can, and then if they test positive, then you notify local hospitals. You communicate with staff and attendees, noting that for particularly employees, and Brian could comment on this a little bit later, perhaps, with the Americans with Disabilities Act. If you go out just telling everybody who's infected, there's a potential issue there. So be cautious about that. But notify the people coming to your church, look, there was someone that was infected, and then you for having been in place where someone was infected. As I conclude this particular section, just coming back to, I think, the big one for many church leaders right now, and that is, okay, taking all of this, when do I open? And I know that there are many pastors that want to open this coming Sunday. And again, my point here today is to give you information. The God has not released us to meet beyond the level of 10. Again, our general advice has been to work together with government until that is changed, though I certainly respect if pastors come to a different conclusion. But if we meet, just following these guidelines. And then also just we could face a couple other waves of this. Hopefully we wouldn't have actual shutdown, according to, shutdowns of services, etc. But there is potential. And so I just want to bring some of that practical information to you. Again, I'll send this out, praying that you have wisdom in your church. But this time, I'm at 1 o'clock. I want to be conscious of your time. So this is for Q&A, and you'll note the Q&A button there at the bottom of your screen, and we're seeing a couple come across as well. All right, so Dr. Beeler, I have about multiple exits. Is that a good idea?
Just a little bit more clarification, like having multiple exits from the building to...
Yeah, when a service is concluded, and you got to have multiple exit points. In research, I do mention aggregating the exit, almost like a banquet and releasing people, but it's got to have multiple exits as well.
So people aren't clustering as they leave?
I believe that's correct.
Yeah, I think that makes a lot of sense if you're able to do it. But again, I mean, the transmission events are happening within households and with people close together for at least 15 minutes. So it's not a huge line out. It just the same as having arrow flow across the facility. It seems like it's a luxury, but not a necessity. I think it makes sense, but I wouldn't expect a lot of transmissions to happen in that setting.
All right, another question for you, and I addressed it just briefly, but if you could go into more detail, how to deal with a previously infected person, and that's the guidance that I have here. I'm assuming that's somebody that may have been infected previously and has now recovered. If somebody develops symptoms there in a service, how does the church respond?
So as it relates to someone who has been infected but has recovered, that's $1 million. No one knows what to do with these people right now. We presume non-infectivity or sense of clearance. If someone has been essentially isolated or quarantined for 14 days, they have improving symptoms and they've been afebrile for 72 hours. That's what we've been using outside of having to test to decide if someone is safe to kind of return to the general hospital population, and it would apply outside the hospital as well. But in general, it is unknown as to the infectivity after. So it's a guess.
That's helpful. Next question is, for churches with multiple service a day, what do we need to do in terms of sanitation between services?
That's for me.
Yes.
So the virus is that almost anything would kill it. So any EPA registered disinfectant will kill the virus. It's going to be really tough for big churches, but as best as you can do to wipe down high touch surfaces. So those are going to be door handles. Those are going to be railings. That's probably going to be your highest yield. And if you could get to the individual chairs or pews, that would also be helpful, but acknowledge that that's going to be pretty tough. I honestly don't think that contact, so touching something that someone else has touched, is going to be the major way that this is transmitted, even though it is possible to be transmitted that way. I think it's mostly going to be respiratory droplet.
That's helpful. Next question is for Attorney Bowman. With the advised restrictions for phased reentry to worship, say a 70-year-old decides to come back and then they get exposed or infected, could church be liable?
Yeah, and really to answer that question, I think about how can you, that's while this is much more catastrophic, people are infected every day by where they are. When this first broke, it was a real substantial question as to whether people who, as part of their job, first responders, first dog leader, they become infected, are they then covered under workers' comp for whatever may happen? And really, a lot of the insurance companies got together and just voluntarily determined to provide coverage. So really, the first question is how would you possibly know that someone became infected at church? Now, if they did, if that was knowable, if that was provable, then, and if you're not following the guidelines that have been put out there, there's always going to be that chance that you could face some liability for that. So that's probably, even a better reason to follow that. But I don't think you all make your decisions about how to run your worship services or the ministries that your church offers because they have a liability risk. Everything the church does is going to have that risk of liability. Anything that a law firm does, anything that a physician does, has that risk of liability. You make the best decisions based on the best information that you have, and then you encourage people to follow them. And that's what I would encourage you all to do as well.
That's helpful, and thanks, Brian. And one thing I felt in from the resource we're sending out, and I've heard, which is, I think, a good idea, just like Walmart had dedicated time for those that might be in higher risk categories, is to actually just schedule this once we're reopened for those in higher risk categories that, of course, are healthy at the time. So maybe that could help with that as well. The next question for Dr. Beeler, can you explain what we'll learn as more data comes in from the antibody studies?
Antibodies, I think, are a useful piece of information from a public health or epidemiologic perspective. It shows us what the rest of the iceberg looks like. So we're seeing just the tip of the people who are presenting for care, but what does that rest of the iceberg look like underneath it? So beyond that, I don't think it's going to change much clinically or diagnostically because we're not entirely sure the reliability. We don't know if antibody yet is protective. So it could be that even though you've been infected, you could get infected. We don't have that answer yet. So it gives us information as to the percentage of the population that has already been exposed and therefore potentially how close we are to herd immunity if it's a protective antibody. But beyond that, we don't really know a whole lot.
All right, so next question back to Brian here, and I'm actually going to throw to your direction. First of all, we have multiple rooms with separate exits. Can we have each separate room, or is it limited to 10 per facility? And then just to put you further on the hot seat, would it be helpful for churches to have a waiver or maybe an attendance agreement?
I would not favor the waiver. Really, probably three reasons. One, I think actually having them physically take a piece of paper, sign it, and hand it back to you probably creates a better risk you're going to spread something in the first place. So I think just for protective purposes, I don't think I would do that. Second, arguably, it's not even going to be enforceable. If you have someone there that that's that acute and is that sure, you ought to be there anyway. So I wouldn't have a waiver, I don't think. And your other question was, is it 10 per room or 10 per facility?
That's correct. Yeah. Yeah,
you didn't know that answer, which is why you kicked it over to me, Josh. Thank you.
Fair
enough. I think it's 10 congregating in any place. So, I think about like my office, which has multiple floors, it's not 10 per building for the entire office tower. So a lot of that's probably going to depend on how your church is structured. If you think of a church with a multi-facility campus, it's going to have a bunch of different entrances and they're all going out different doors and they're parked different places. That's looking like 10 people are staying separate. If, the more average sized church, which are probably 95, 99% of them, you're coming in and out 1 to 2 doors, you're just in different rooms, you're crossing each other in the hallway. And I think that is going to be the 10 per facility. Now that question might have been in the context of, can we all still go to the church building, meet in separate groups of 10? I think that answer is probably no. I don't think that's what the idea was behind meeting in separate, like small group homes, and then maybe everyone calls in together, whether it's Facebook Live or whatever form you're using for your online services.
And that's a helpful answer. And I also have to consider the church as a public witness, and there's no real effect over your parking lot. And so if everyone in the community thinks you're just back to meet, it could raise public relations issues. And again, deferring to your conscience and how you feel in your church, but I think it could complicate that. If you had separate building, perhaps that could be utilized for additional meetings. My understanding is meetings of less than 10 people. So this discretion, I think that's good guidance. Something that's mentioned in the new CDC guidelines, and I'm interested in your take on this, Dr. Beeler, and that is, what about outside meetings? Now, there's no clarity in the governor's order saying, yes, you can have those kinds of meetings, but as we move forward, would an outside meeting help lessen the risk of infection?
I think absolutely. This virus is dampened by heat and it's dampened by humidity for Indiana. So it seems to be less infectious in those scenarios. In addition to that, data showed there's really only been 2 cases of transmission outside where it was from standing close together and talking to each other for an extended period of time. So it seems less risky to me outside than it does inside for sure.
Another question I received was, can you provide specific attendance gatherings of people according to the gates that you mentioned, kind of from the reopening phases?
No, I can't. I think it kind of has to be on a case basis and based on what your facility is able to do. So, for instance, I think if you say that 6-foot radius around our families, because I don't think you need within a family 6-foot radius, but between families, we're trying to keep a 6-foot radius. You know how many people that we need for service. In order to keep 6-foot radii around patients, we need to take out shared receiving areas, and that would give you an idea of how many people potentially do. And then as the gates kind of get passed, then maybe in between people and the amount of pews that you're reserving for that 6-foot radius becomes less and less. But absolute numbers, there's just too many factors that go into it.
All right, so I see that we are at the 1 p.m. mark. I still have a number of questions. I'm going to pause you for just a second. It's all right with our presenters. I would like, if we can maybe cap it by now, but I'd like to at least get to the ones that we have. But I understand that some need to jump off. I want to be conscious of their time. I just want to thank you for joining us today. I want to take a prayer for our ministers and other leaders. Ask Brian to do that. If you could just briefly pray for our attendees as they're making these tough decisions. And then I will be sending out an email with the various resources that we've made. And if I can be of help to you, Brian can be of help, please do let us know. We want to be a resource to the church at this time. So again, I'm asking Brian to pray. Thanks for joining us. If you want to catch the answers to the remaining questions, hang on, we'll probably go maybe 5-7 minutes after. All right, Brian.
Dear Heavenly Father, we just are thankful again to come to you today collectively, even though we can't see each other. Where our hearts and minds lie, and I just pray for each of the ministers who are on here, who you've called and you've chosen to lead a flock, and that leadership typically is there to share your word. And to comfort in times of trials and strife, but it's also to lead wisely and to lead winsomely. And I know that in every church, the number one person who wants to be there in person and live is going to be the pastor. And so they're also all very, very human. And just to continue to give them the wisdom, surround them with others who are confidants to them, who they can go to, who you can have freely conversations with, because they know that they're all there to protect the health, the physical health and the spiritual health and welfare of every member of their flock. And let them continue to be brave, to boldly and proudly proclaim your gospel, but to be mindful too of the appropriate way to interact with our government authorities, and with all of our families and neighbors who watch us closely and from afar, to be able to reach out to them, to be able to comfort them in this time of stress and uncertainty, and but also just always to proclaim your gospel message. In your heavenly name we pray this afternoon. Amen.
Amen. So we'll jump right back into the question. The next one I'll direct to Dr. Beeler. How should individuals that count tithes and offerings, so even if you have a state deposit box, they're putting it in, somebody counts it, how should they protect themselves? Are gloves enough, or should they also be using masks?
I'd actually recommend everyone wearing a cloth mask at this point. Yes, gloves, as far as the contact goes, the gloves would be adequate. I would just make sure that hand hygiene products are available to them as well.
Hey, can I check, Dr. Beeler? So our governor had a big announcement yesterday, and I know we've talked. What are these cloth masks that people can get?
Where are they?
Do we make them?
Sorry,
I said yes. Where can they be obtained, or can we make our own?
Yeah, definitely. You can make your own. The cloth mask could be anything from a bandana to your shirt pulled up over your face. It doesn't really matter. It probably all does an equivalent amount of blocking, which is probably okay, but not optimal. But it's what we got. So if there are people making masks, actually the CDC website has great instructions with measurements on how to create cloth masks that will fit over your face, can be washed in between and utilized.
That's helpful. And I would mention a question about where can we find disinfectant, where can we find other sanitation. It's not one resource, but just maybe smaller kind of resources might be your best bet at this point. Is something I'm hearing from some of the larger. This is a question from a pastor in a more rural area. Should areas that have that are less affected by the virus, should they be under the same kind of strict stay-at-home order as elected areas? Let me toss it to Brian first, and then I'll also be interested in Dr. Beeler's opinion.
Yeah, well, and again, that's going to be part of kind of what the governmental authorities say. You know, our governor has announced last week that this is an all or nothing approach, that it's going to be statewide. You know, I think the public health threat is going to get more and more dissipated to one particular area. Part of what we've been dealing with here is the notion of our, you know, county lines on a map are just that. They're on a map. The virus is not thwarted by the middle road, which is the county line designation, but it's not by state borders either. You know, if it can jump the Licking River, it can jump the Ohio River. And so, you know, how much longer the government can continue to establish that everyone must be on lockdown, if anyone must be on lockdown, I think is a particular case certainly to be looking at. Now, the other aspect of that is I think you're seeing a lot of within those local areas, you're seeing a lot of those governmental leaders, those health department leaders, they're already starting to have that conversation. So what I would say to that is, you know, reach out to your mayor or to your county leader, to your health department director, and offer to be part of that conversation to say, look, I understand that in particular areas, they're significantly worse off than we are. The public health threat isn't here as bad as it is everywhere. Now, I don't know that answer lies this week, but I think those conversations can start being had so that when that time is right, then maybe you can get that answer. So I would encourage you just to reach out to your local leaders, try to be part of that solution. Yeah, I do. Another part of my law practice, I represent a lot of cities and counties, and a lot of those discussions are occurring now. And so I would say, as much as you want your church to be open, so do the business leaders in that town, so do the small factories, so do the restaurants, and so do the mayor and the local officials. So I think everyone's goal is still the same. So as much as you want to be open, they do too. And so reach out to them, try to build a coalition and to help have those conversations.
That's helpful. And Dr. Beeler, what's your medical opinion on that?
I mean, I think it makes a lot of sense to have different approaches to different areas based on local epidemiology, which is why I think that knowing your local numbers is crucial. And then also based on those numbers, having different levers that you can pull and push to turn things off or turn things on based on if you're seeing local rises or local improvements. I think what this is going to turn into over time is we're going to see pockets pop up in different areas, and the different locales need to be able to respond appropriately. So I think having a regional response to this, it makes a lot of sense.
So we have two more quick questions, and I see Steve Yen's question about getting that resource to you for a meeting with your in the faith community. What an awesome opportunity, and so I'll get that to you before talk today. So two last questions: are masks and gloves mandatory obligation, or are they a suggestion? I was looking at the CDC requirements. It seems to be a suggestion, but do you have any thought? And Dr. Beeler, do you have any thought on that?
Yeah, I don't know. Our governor announced yesterday he's asking everyone to please wear a mask beginning on May the 11th. Which seems voluntary, but if you don't, businesses may bear, businesses may. So I don't know that what that answer may be, and I suspect it's going to change over the next few weeks.
Dr. Beeler?
Yeah, I don't think there's any mandate, and I'd be really hesitant to suggest a mandate, but I'm wondering if we're going to see kind of a shift in our culture to expect it, like you were mentioning. Just that people are going to, if you're not wearing a mask, then there might be stigma associated with it. So no, I'm not aware of any mandate. I don't think there needs to be a mandate, but certainly if you're sick, that would protect people around you.
And you'll find in the PDF that I'm going to send out just a general recommendation that I'm seeing from various ministries that when people do come back, even if it's not a mandate, they want to know that they're safe. And so I think just to try to address concerns about that, I think it's wise to, even if those masks and gloves to people, maybe get some ladies in your church so you have them available. I think that can be helpful in answering people's concern. All right, so last question. The 10 people limit, person limit, is above the minister and staff. There's been an issue at the Fisher Church question. So Brian, what's your opinion?
Yeah, so that came specifically from the Kansas rule, because the Kansas rule was no gatherings of more than 10 people. But certain ones were exempted, which included like the pastor who was delivering the sermon. So that was very Kansas specific. I don't think that you all have that rule in Indiana. The other question that follows that is why 10? Why not 8 and why not 12? That's one of the doctor's questions. That's not the lawyer question. So I don't know.
Dr. Beeler, we're wondering, we're all hanging here because we want to know where did 10 come from?
Everything is based on football scores. So I think we'll give it 7 days of treatment, or 14 days of treatment, or 10 days of treatment. So I bet it's just they just picked a nice round number to use. I don't see any science behind that.
Yeah. So it's not.
What I would say is this, though: we set that rule for yourself. Count everybody, because it's not like the people up on the podium aren't breathing. So rule you want to set for your church going forward, include everybody in the building.
And I would just second that. I do think that it's referring to a gathering of 10 or less. And in Indiana, we have the state stay-at-home order, which churches are essential. However, they should not meet in groups of more than 10, which refers to White House's requirement. And part of the confusion in all of this has been 3 government, White House, state, local. But that's the current status of the Indiana order. I've heard of churches having kind of their worship team up on the stage and then other people in the back. But I think if you're going to tightly review the rule, it says 10 less in a gathering, or less than 10 in a gathering. So those are our questions. And Dr. Beeler, Brian, I just wanted to thank you so much for taking some time. It was extremely helpful to me, and I'm sure to the pastors that participated. We'll record it. And just want to say thanks again for taking the time to be on.
Thank you, guys. Nice to meet you.
Yeah, you as well.
Take care.
Bye.